Hello everyone, this is Myla T. Sarmiento, and I will be differentiating standard precaution and transmission-based precaution. So let's start. The standard precaution. Standard precaution are the work practices required to achieve a basic level of inspection, prevention, and control. The use of standard precaution aims to minimize, and where possible, eliminate the risk of transmission of infection, particularly those caused by blood-borne viruses. Standard precautions apply to all patients regardless of their diagnosis or presumed infection status. Standard precaution must be used in handling of blood, including dried blood, all other body fluid substances except sweat, regardless of whether they contain blood, non-intact skin, mucous membrane. There are elements of standard precaution. The hand hygiene before and after all patient contact, the use of personal protective equipment which may include gloves, impermeable gowns, plastic aprons, masks, face shield, and eye protection. The safe use and disposable of sharp, the use of aseptic non-touch technique for all invasive procedures, including appropriate use of skin disinfectant. Repros- Reprocessing of reusable instrument and equipment, and routine environment cleaning, and also the waste management, and respiratory hygiene and cough etiquette, and also the appropriate handling of linen. The hand hygiene. Hand hygiene is considered one of the most important infection control measures for reducing the spread of infection. Hand hygiene is a general term that refers to any action of hands cleansing, such as hand washing or hand rubbing. Microorganisms are either present on hand most of the time or resident flora, or acquired during healthcare activities, which is transient flora. The aim of hand hygiene is to reduce the number of microorganisms on your hand, particularly transient flora which may present the greater risk for infection transmission. Personal protective equipment, or also called as PPE. PPE used in healthcare includes gloves, apron, long sleeve gown, goggles, repellent surgical mask, face visor, and receptor mask. The initial risk assessment of whether or not PPA is required is based on the level of risk of transmission to and from the patient. The gloves. Gloves are pieces of clothing which cover your hand and wrist and have individual sections for each finger. Gloves provide an effective barrier for hand from microflora associated with patient care. And gloves should be worn when a healthcare worker has contact with any patient secretion or excretion and must be discarded after each patient care contact. Gown and apron. Wear an apron or gown to protect skin and prevent soiling of clothing during procedures and patient care activities that are likely to generate splashing or spray of blood, body fluid, secretion or accretion, or causing soiling of clothing. We select a gown or apron that is appropriate for the activity and the amount of fluid likely to be encountered. If an apron is used, staff should ensure they are bare below the elbow. The goggle. Eye and face protection must be worn when there is risk of splashing body fluid into mucous membranes. Eye can be protected by wearing either goggles or visor. Personal glasses are not suitable as substitute. If reusable eye and face protection is used, it should be decontaminated in accordance with the Manufacturer guidelines. Hands should always be contaminated after removing the equipment. The surgical mask. Provide barrier protection to the wearer from slashes and droplets to the area of the wearer's nose, mouth, and respiratory tract. They do not provide protection against aerosolized particles and are not classified as respiratory protective equipment. And lastly, the respirator mask. The purpose of respiratory protection is to protect the wearer from the pathogens spread by the airborne route. Example is the measles and chickenpox, tuberculosis, and when performing aerosol generating procedure on patient with suspected or non-influenza or other respiratory tract infection. Advice on their use is available from the IPC team and may be required by healthcare workers and visitors in certain circumstances. The clothing and disinfection. No, the cleaning and disinfection. Cleaning. Cleaning with warm water and detergent is a process that removes visual dirt and contamination and in most cases is effective for decontaminating both equipment and environment. While the disinfection is a process that reduces the number of microorganisms to a level at which they do not present a risk to patient or clients. It is only effective if surface and equipment have been cleaned truly with detergent and water beforehand. Cleaning and disinfection of the environment. There are many types of cleaning and disinfection of the environment. First is the routine general cleaning. Cleaning of the environment should be undertaken at least daily. Throughout cleaning with neutral detergent and water is commonly used. If soiling with blood and early bodily fluid is evident, then general cleaning should be followed and the disinfectant clean using a chlorine releasing product and sodium hypochlorite or chlorine dioxide solution. If using a hypochlorite solution, the area should be rinsed and dried, although this is not required with some chlorine dioxide solution. Always ensure that surfaces that are being disinfected are compatible with the product being used. Enhanced cleaning. During an outbreak of infection or unusual increase in the incidence of particular organism, enhanced routine cleaning is recommended. This will initial cleaning, disinfecting the environment, including frequently touched surfaces such as bed, tables, bed rails, the arms of chair, sink, call bell, or door handles, and push plate, and any area pieces of equipment that may potentially be contaminated, depending on the type of outbreak and the healthcare facility. Certain areas will require more frequent cleaning and disinfection. Example is sanitary areas during an outbreak of gastrointestinal infection. And lastly, the terminal cleaning. Terminal cleaning is the throughout cleaning disinfection of all surfaces, including floors and reusable equipment either within the whole healthcare facility or within an individual ward department unit. This may be required in the following circumstances: following an outbreak or increased incidence of infection, following discharge, transfer, or death of a patient who has had known infection, and following insulation, contact precaution nursing of a patient. A terminal clean will be advised following decision and argument between the infection prevention and control team and the nurse of manager in charge of the ward unit facility. The terminal clean should not commence until the relevant room and area has been fully vacated. Respiratory hygiene and cough etiquette. What is respiratory hygiene and cough etiquette? These are infection prevention measures designed to limit the transmission of respiratory pathogen spread by droplets or airborne routes. The strategies target primarily patient and individual accompanying patient to the dental setting who may have undiagnosed respiratory infection but also apply to anyone, including dental healthcare personnel with signs and symptoms of illnesses. Transmission-based precaution. The transmission-based precaution are the additional measure focused on the particular mode of transmission and are always in addition to standard precaution. They are grouped into categories according to the route of transmission of the infection agents. The transmission-based precaution should be applied when caring for patients with known infection, patients who are colonized with an infectious organism, asymptomatic patients who are suspected of under investigation for colonization or infection with an infectious microorganism. The contact precaution. Contact precautions are required for patients known for suspected to be infected or colonized with microorganisms that can be transmitted by direct contact or through the patient's secretion or bodily fluid. Contact with occurs when performing patient care activities that require touching the patient's skin, secretion, or bodily fluid, or indirect contact. Example, touching for potentially contaminated environmental surfaces or equipment in the patient environment. Contact precautions are required to protect against either direct or indirect transmission. The direct contact transmission involves body surfaces to body surface contact and physical transfer of microorganisms between a susceptible person or host and infected or colonized person, and more often occur between a healthcare worker and a patient than between patients. While the indirect contact transmission involves contact of susceptible person or host with a contaminated intermediate object such as needles, dressing, gloves, or contaminated hands. Disease is more likely to develop following direct or indirect contact transmission when the pathogen is highly relevant or has a low infection. Those are patient or healthcare worker is immunocompromised, and poor hand hygiene is most often cited as a cause of contact transmission. The droplet precaution. Droplet can be generated from the source person during coughing, sneezing, talking, and during the performance of certain procedures such as suctioning or bronchoscopy. Droplets may contain microorganisms and generally travel no more 3 feet from the patient. This droplet can be deposited on the host nasal mucosa, conjunctiva, or mouth. Disease requiring droplets precaution include that are not limited to pertussis, influenza, diphtheria, and invasive meningitis. The airborne precaution. Airborne precautions are required to protect against airborne transmission of infection against. Disease requiring airborne precaution include but are not limited to measles, severe acute respiratory syndrome, varicella or chickenpox, Microbacterium or tuberculosis. Airborne precaution apply to patients known for or suspected to be infected with microorganisms transmitted by airborne droplet nuclei. Preventing airborne transmission requires personal respiratory protection, special ventilation, and air handling. In conclusion, standard precaution are the work practices required to achieve a basic level of infection prevention and control. And also, standard precautions are the maximum infection prevention and control practices that must be used at all